At the top tonight, according to health officials, as COVID infections among kids remain high for our area, vaccination rates remain low.
Tonight, the director of infectious diseases at Driscoll Children's Hospital says despite the Omicron variant, the vaccine is continuing to help prevent hospitalizations among kids. However, there's still one group that cannot get the vaccine: those children under 5 that remain the most vulnerable. Our Bill Churchwell reports.
Yes, we are seeing more cases of COVID in children, more than before, more than with Delta.
Dr. Jaime Fergie is the director of infectious diseases at Driscoll Children's Hospital. While cases are up, he says the difference with this wave is that the hospital is not seeing the severity that it experienced before.
With the Omicron, we're seeing more of this upper respiratory tract infection, more of this so-called bronchiolitis or croup. In the hospital right now, somewhere around 14, 15 patients.
He is reminding parents that kids 5 and up can get the shot with parental consent, and boosters are available for kids 12 and up. But despite the availability,
I believe less than 1/3 of those children have received the vaccine so far.
So he's encouraging those vaccinations.
We know that with the Omicron variable, the protection is not as robust, but it still prevents hospitalization, still prevent going to the ICU.
As we've reported, Driscoll Children's Hospital is one of about 50 hospitals across the U.S. that are taking part in the Pfizer vaccine trials for kids, helping pave the way for FDA approval. But there is still one age group that remains unable to get the vaccine: those who are under the age of 5.
Remember, and it's public knowledge that Pfizer indicated that there was not enough immunological response on those younger kids 2 to under 5. So they were a little concerned with that. Nothing bad happened at all, but the level of immunity that was developing those children 2 to just under 5 was not as robust on the other kids.
Dr. Fergie says about 150 children here locally have taken part in the trials. That includes children as young as 6 months old.
Without children participating, without their parents agreed to participate in studies, there will be no vaccine for children at all.
Recently, Dr. Anthony Fauci says that the FDA is awaiting data from a trial that would determine adequate dosage for the Pfizer vaccine. He says that could come within the next month or so. Bill Churchwell, 3 News.
Thank you, Bill.